So it's me, Elizabeth, here with Miss May, my 16-month-old, and we wanted to talk with you guys about some of the benefits of extended breastfeeding, breastfeeding a toddler, breastfeeding past the age of 1. So, just a disclaimer, this video is in no way meant to make people who don't breastfeed at all or who choose to end their breastfeeding relationship early or anything like that. I don't want to make anybody feel bad about the choices that they make. This video is simply to help inform those who are thinking about extended breastfeeding. May is right by the camera, so I apologize. Inform those who are thinking about extended breastfeeding that perhaps it is a good idea. What do you think? Do you like nanas?
Help.
Oh, you need some help. Okay. Yeah. So if you are interested in the 10 benefits and things that I enjoy about breastfeeding a toddler, then just keep watching. The American Pediatric Association recommends breastfeeding to a year and then beyond if mother and child both agree to it. The World Health Organization actually recommends breastfeeding to 2 years and beyond. So 2 years, obviously well into being a toddler. Oops. It is something that is recommended for a whole multitude of health reasons. One, there's still so much nutrients for kiddos with breast milk. Toddlers are picky by nature. One day May will eat chicken. The next day she acts like I'm trying to poison her. Breast milk kind of fills in the gaps with nutrition, and I know that she's getting enough. My breast milk is constantly changing to meet her needs. Milk made after a year while they're going to be taking in less is fattier, still full of antibodies to help her fight infections. I mean, it is amazing, amazing stuff. So just after a year, it's not like it turns into water. It still has great nutritional value for your kiddos. So that's one reason why you want to continue to breastfeed. So another reason why extended breastfeeding is recommended is for the mother's health. So breastfeeding reduces your risk of whole types of cancer. I'm going to read them off. Breast cancer, ovarian and uterine cancer, and endometrial cancer as well. It reduces the risk of osteoporosis in women. It helps strengthen our bones, and it also suppresses ovulation in some, which can be good because it's also recommended not to have, back-to-back pregnancies. It's good to give your body a bit of a rest. So recommended, I think, 2 year spacing minimum in between pregnancies is what the World Health Organization recommends. And while breastfeeding is not a successful form of birth control for all, and you should use backup, it can suppress ovulation in some, which is one reason why it is recommended to extend your breastfeeding. Human breast milk is a natural laxative. That's why very few breast babies get constipated. Cow's milk is the opposite, and most children get constipated on cow's milk, and then you take this constipated child and you're trying to potty train them. Does that make any sense at all? I don't think so. So we also just aren't doing cow's milk. We're using Ripple, which is made from peas, and it's a cow's milk alternative. But we also continue to breastfeed, which is a great laxative. May poops multiple times a day, and she's never been constipated, which is awesome. Nobody likes being constipated, children or adults alike, right? Some things that I find that make breastfeeding easier with an older child, with a toddler, is that it's much shorter in duration. So May's typical nursing sessions are like 2 minutes per side. Sometimes she gets on in just like 30 seconds. She just gets through the letdown and then she's good. Sometimes, in the morning she might do like 5 minutes on each side, but it's much shorter than, 15 and 15 every 3 hours. If we're out and about, she can totally go, 6-7 hours without nursing, and she does not nurse at all at night anymore. So while she is still nursing quite frequently, and she nurses on demand whenever she asks, I, for the most part, do allow her to nurse, as long as we're not, like driving or something crazy. The duration of time that she's nursing is a lot shorter. It's also nice because she can ask to nurse. Toddlers, older infants can use sign language. This is milk. A lot will do that. Or May calls nursing nanas, so she'll ask for nanas. And that's really helpful because I know exactly what she wants. Whereas with a small infant, they're crying, and it could be for a multitude of reasons, and you kind of go through the list to figure it out. With an older child, when you're nursing a toddler, they say nanas, they want to come nurse, they say milk or whatever they say. So that can be really, really helpful. So something else that you might notice with a toddler, my child has been in this video like a total of maybe 30 seconds, is that they are go, 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 go. They're always doing things, always out and about, and so that snuggle time is going to be at an all-time low. Breastfeeding allows you to have that chance to snuggle, to hold your child close still, even if it's just for a few moments or even a few seconds, and it's really, I think it's good for both of you guys. In addition to giving moms snuggle time, breastfeeding is comforting for a child. Toddlers are going through some really, really tough transitions, learning to talk, walk, express themselves, feel all these emotions, and getting teeth. Oh my gosh, May's getting 5 right now. And breastfeeding is a way for a child to comfort themselves and to provide comfort in a way that is healthy and strengthens the bond between mother and child. One thing that's really awesome about extended breastfeeding is the convenience factor. Sometimes you might have forgotten a snack, or they've had all the water that you brought, and so when you have your boobs that are with you at all times, you can't get rid of those, you can always nurse your child, and it can be really useful, especially, again, comforting. We're having a public meltdown, a little bit of nanas, a public meltdown. What, can I help you, May? Do you need help? You want to get up? Okay. Very last things that I want to talk to you guys about extended breastfeeding that I think is useful and makes it easier than breastfeeding a newborn is you're not so worried about your supply, right? Because your child's eating, drinking water. Would you like your water? Yeah, and it just makes things a lot easier. Like I said, nursing is convenient. Anyway, for those of you who kind of were thinking, yes, breastfeeding for a year, that's my goal, and got to a year and thought, my baby's not done, you're right, your baby's not done. And it's okay and it's normal to continue to breastfeed. There are tons of pros. There are some cons, which I will go over in another video, but there are cons to doing anything as a mom. Things are tough, but your baby still needs you, and it's okay to continue to breastfeed. And look at that, we're done. Thank you guys so much for watching. I hope you have a wonderful day. Subscribe for more breastfeeding and mommy videos. Do you have anything you'd like to say, May? Hi. Can you say bye-bye? Bye-bye. Bye, guys.